unzip you so I can show Elaine how to do some of the rib raking. And we'll just slip this right out. You can pull it towards you.
Okay.
Yeah. And then we'll tuck this away so that you can see with Mary, we've got easy access to in between her ribs. And if you put a little on your fingertips, then you can push away on my side and I'll push away on your side. So I'm going to be pushing like this.
Okay.
And you can make little claws out of your fingers. You've got nice short nails.
Yeah.
And let them fit in the groove. Let me show you. So it's like this. It'll be about 3 of them in the groove here. Okay, let them fit. Make more of a claw-like and push towards me. One set.
Just one?
And then the other. Yes. And one. And then the other. And I'll show you how to be a bit smoother about it, Elaine.
Okay.
So you can start right at the sternum and push off way out there underneath. And the sternum and push off like that. Yeah. And don't be afraid to be more on the tips. You want to get in between the ribs, so don't go so fast. Feel the groove and then let it glide along the groove. That's better. And then the other one's right behind it. So one push and the other's pushing. That's it. Yes. And I would put the knee up just so that you're able to last a while. You got it? Good. And I'll do my side now. 1, 2. So I'm really letting it groove along there. Like that. Now we can go a little lower. Like this. And again, it's all off the sternum. Like that. Okay? That's it. There, very nice. And that keeps the little intercostal muscles loosened up, and it makes it easier for Mary to take breaths. But you should be more off the sternum. So don't be afraid to come farther back.
Okay.
Those large pectoralis muscles like to get a stretch. That's very nice. One, and then the other. Nice work. Great. So Janice, I'm going to tell you what we're doing for respiratory. And we're doing
so you did that rib.
We did the rib breaking. Then we lift Mary's shirt up. And because she's got such a teeny weeny tummy, that's what's challenging, right? Mary has the teeny weeny patellas, the teeny weeny everything, and no tummy, you know, because her ribs are going to be ending like right there. And then her hip is starting like this much below it. So she is long in the leg for a tiny person, but short in the tummy. But this is where we need to spend lots of time, is all around here and doing this fingertip kneading, and it loosens up the diaphragm. The diaphragm is a big dome-shaped muscle, comes from the front in like this shape right over to the back. So when we're underneath in the back, just keep going. Yeah. When we're underneath in the back, we're loosening up all of the back and the thorax and that kind of thing. When we're coming around the front, we're doing all the rib breaking all the way down her ribs. The breasts get in the way on women, but we're lucky that Mary's
Sorry, Mary.
modest in the breasts, so that we don't have to worry. We can do quite a bit of rib breaking. The other day we accidentally had a little show, but my hand was covering it up for the camera, so we won't get any higher ratings than. Yeah.
That could be flash.
That flash. Yeah, was that with you?
Yes.
Yes. But in the edit, it turned out okay. Okay. Now we're going to go up this way, and Mary's got this gastro tube for having lunch and that kind of thing. But at the bottom of things here, we're going to tuck this way up here. And Mary, I'm just going to tuck your tubes and things, whoops, out of sight. Okay. So along the bottom here, Elaine, we're going to just put a little bit of coconut oil there.
Okay.
And Mary will edit out that breast shot. We just had a
You're
little
flashing us.
unduly revealing. Okay, so here you can push away and push away on the lower ribs like that.
Straight?
Yes. And you can open it up a bit, like we were doing here, the claw-like grip.
Oh, okay.
Don't be afraid to be on your tips.
Alternating?
Yes. 1, 2, very nice. 1.
Let's start further back.
Yes, exactly.
Okay.
Great.
It's the feeding tube.
Yeah, and that's intimidating because you look and you go, oh darn, what am I going to do now, right? But we'll show her how to get around it. So we take our fingertips and just keep going. And we work all around. And the diaphragm and the costal angle, they're at an angle here. So they're not straight across, they're just like this. And then even if we have the other end of it, it's only like right there. So we tuck Mary's pants down just a little bit here so that we've got a bit more tummy to play with. And the ribs are going to keep going way down to there. Those are what are called costal ribs. And there's floaters around.
Sorry, I just got to figure out where you are because I'm thinking you're a bit low. Yeah, no, her rib
Feel
is actually.
that?
Yeah, you're coming up from underneath it, but
Right.
her rib, it's easier to make sure you don't go too far as to
Yeah.
come down.
But if you feel this one, feel where we go back here, right there. So what I
Yeah,
do,
that's-
I'll show you my stroke.
Wow, yeah.
So I go way around the back here, because one of our biggest concern is the lowest lobe.
Yeah.
The lowest lobe is where things are going to fill up, and if we're going to get any infection setting in, it usually starts in those kind of areas where there's congestion. So your hand can wrap to Mary's shape. You just tuck it around, and we have like coconut oil and that kind of thing to make it easier slippage. And you get in the back there, and then you just slowly pull towards you. And it gives some compression to the chest as you're doing that, and then you slip your other one in. And is that too much pressure in the front, Mary? And it really helps ease up her breathing. So you work right from the sternum and all the way out towards the attachment here. The big pectoralis muscle attaches right into here. So we do fingertip kneading in the back, fingertip kneading in the front.
Or a little harder? Firm enough? Okay.
I think we're pretty equal from seeing. And I'll show you this one. It's called rib breaking. And, yep. And you get a claw-like position to your fingers. You're good, Peggy. You got a real knack. I remember that with the babies. There was a mob scene that day when I was teaching you baby massage. And you had a really good way of working with your little one. And then you can go right down. Yeah, and even more of a curve in your fingertips. Yeah. Yeah, and then back up again. And all along inferior to the clavicle here.
Mm-hmm.
And you can work with little teeny fingertip kneadings all below the clavicle there. And that really helps ease up the tension. And it's nice for people to learn that they don't have to get oil out,
Yeah.
and they don't have to have skin-on-skin contact to make
Yeah.
a big difference to the circulation. But it makes a big difference at the end of the day. You know, just
helps
the...
you, helps her relax.
Mhm.
Yeah.
Yep.
It would work for me.
And then at the top here, just like everybody loves getting the top of their shoulders done, this is one that I haven't taught you. It's alternate thumb kneading, and they're little circles that go up and out. Yeah.
Above her collarbone?
Well, I was just practicing there, but where I meant to go was,
Up here.
yeah, all along the very top of the shoulder there. Nice work, Peggy. Yeah. You got Mary purring. And then you can slow it down too. And the slower you go, the deeper you get. So it's a nice way to take your time. And Mary does a lot of head movement. So these muscles, the trapezius muscle out here is getting a workout.
Mm-hmm.
And our focus in Mary's general overall massages are to be able to help her with the tension it is to keep her head.
Right.
She doesn't wear a collar all the time. She
Yeah.
wears a collar for support being transferred, and her head is supported, but she's still using muscles to keep it in place. And her leg, she communicates with her legs. So.
That too hard?
Do you want me to get Lou for a
Suction?
suction?
Okay.
Okay, Lou, we produced some pretty good stuff.